I'm Dr. Dorothy Ponton of KnowYourBodyBetter.com, and today I'm going to help you answer the question, should I use heat or should I use ice? It's a question I get a lot from my patients. Heat always feels good, and so we're very tempted to put a hot pack or take a hot bath or get in a hot tub anytime we have something sore or tender. And sometimes heat is the right thing to do. Most of the time, you're probably going to want to ice. Ice is great for controlling inflammation, and you'll know you have inflammation if there's pain in just about every range of motion when you try to move an area that's been injured. There'll be redness, there'll be swelling, it'll be very tender to the touch, and it will feel very different from a muscle that just needs heat. A muscle that just needs heat will feel like this. Take your fingers and squeeze them together tightly. Now, touch the base of your thumb and the muscles in your thumb pad, and you'll see and feel a very contracted, tight muscle. If you've got an injured area that still feels like that even after you've tried to relax it, that might be an area that needs heat. But an inflamed area will also feel like it has water in it. Your finger will very easily go into an inflamed area and you'll notice a squishy sensation. It could be quite a small area, but if it's also tender to the touch, it's a little warm, possibly red, and it just hurts every direction you move, you're going to want to apply some ice. I don't think that you should apply a bag of water that's been frozen as an ice pack. It'll do in a pinch, but I think it's worth it to invest in a good quality gel ice pack. This one's pretty big. It's 11 by 14. It's covered in fabric, so I don't have to hunt and find a t-shirt or a towel to wrap it in. And then I can apply it directly onto the skin of an injured area. When you're using ice to help with pain and inflammation, leave it on for 15 minutes and then take it off. If you think you might fall asleep, get a timer, make sure that you're done after 15 minutes, and then wait an hour and apply it again. If you do this at least 3 times a day, most inflamed areas will start to improve very quickly. Research has shown that applying ice packs every hour or so in the first 3 days of an injury will reduce healing time by 10 to 14 days. And applying heat to an injured area within the first 3 days increases healing time by 14 to 21 days. So when in doubt, and if you don't have your chiropractor to tell you whether you should use heat or ice, go on the safe side and use ice.